Hi,
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 hi.
good evening.
Good evening.
We met after a very long time.
Yes, yes. How are you?
All well, all well. How about you?
Good, good. Doing good.
Okay, so I'll start with the introduction itself.
Yeah, sure.
That SheNeed and Sonali have been working together for about 4 to 5 months now. And today we will be picking up a new topic, that is COVID during pregnancy, because a lot of celebrities, a lot of people have been planning the pregnancy due in this lockdown and COVID. And is it actually helpful? Is it life saving or is it time saving? We are going to discuss all these right now.
Right.
So I'll
Sure.
start asking you first question. The first question
Okay.
itself is that should women actually plan their pregnancy during lockdown? Because a lot of women have been doing it.
Correct, correct. Yeah. So I would like to divide this question into three answers. So first, if you are already pregnant during these COVID times, do not panic and congrats. Be happy about it and continue your journey of your pregnancy. Take all the precautions at your personal level and also at the hospital level, the hospital you are consulting with, right? So you said how safe it is to plan during all these waves of COVID. So nobody was sure about the second wave, but it still happened. It was not so much predicted, and about the third wave also, it's not again so much predicted. But so we don't know that. When will it happen and how long the second wave will continue, right? So if you're already pregnant, do not worry, do not panic. Continue your journey safely. Second group of women, I would say, who are undergoing the treatments for pregnancy. It can be IVF or any other pregnancy related treatments. They can also continue their treatments. You never know when you will get pregnant, right? And third group of women who are still planning to get pregnant, my piece of advice for them is that if possible, get vaccinated first, get immune to this virus first, and after the second dose of vaccination, after waiting for 2 weeks, you can definitely plan for the pregnancy. So it's worth waiting and delaying if you're not yet pregnant. But if you're pregnant, please be happy about it.
Yes, what can we do? So the second question is that if a woman tests positive while she's pregnant, what she can do?
Mhm. Okay. So, in my experience, I mean, I had a few friends and my clients who were pregnant and also got this virus in their sixth, seventh month onwards. So, nothing to worry much because most women, around 99% women, show really good recovery with the virus, with mild symptoms like weakness, fatigue, fever, sometimes breathlessness as well. But most of them have shown good recovery in 12 days to around 2 weeks of time span. So only in very rare cases it is seen that there are certain complexities which are developed in pregnant women, like certain blood clots in placenta or low lying or placenta or preterm babies, such conditions. But it is absolutely avoidable if you start your treatment at the right time. As soon as you see COVID related symptoms, consult your doctor, the doctor you're already taking the pregnancy treatment with. So start your treatment, your medicines at the right time, and you can definitely be safe. I mean, you can definitely recover from this.
Oh, yes. So, if a women actually they test positive during their pregnancy, so is there any chances of the baby being harmed, like having a miscarriage or being stillborn, or some of these? Because the second wave was very, very, it was deadly, we can say.
Correct,
So,
correct. Yeah.
this all happening.
There is no such evidence so far. not even in the news, or not even in the, I mean, not even by any doctor. It's published it. So I don't think there is any harm with the baby. It's only the mother who has who develops mild symptoms, like I said. But there is absolutely no harm, or COVID has not passed to the unborn child if mother is positive. The only, I think, the only side effects which they can experience, like I said, extreme fatigue, weakness, or even sudden weight loss, like in the range of 2 to 3 kgs, but nothing apart from that. Yes.
Okay, so there are no long-term effects on the baby after they are delivered, right?
Absolutely not.
Okay. So if a mother tests positive after delivery,
Mhm.
uh, after she has delivered the child, because there's a lactation period and everything going on,
Correct,
what
correct.
advice would you give for that?
Okay, so there's absolutely no need to separate mother and her child, even if she's positive after delivering the child. So she can continue breastfeeding with precautions like wearing a mask, washing her hands before handling the baby, and I mean washing all the surfaces she's touching. It's because most mothers would have mild to moderate symptoms, but if she is experiencing extreme symptoms, like she herself is not able to breastfeed her child, then in such cases we can find alternative modes of breastfeeding, I feel. Like if doctor suggests, then formula feeding, or you can find a donor feeder as well. Otherwise, breastfeeding can be absolutely continued with certain precautions, of course.
So the second wave, considering the second wave, which was actually very deadly, it had a completely huge impact on the lungs of a human being. Wouldn't that be considered a key factor of not breastfeeding for the mother? Because if she is not able to breathe properly, even when she is pregnant, isn't it affecting in any way the baby's health?
Uh, no, I don't think so. And like I said, there is no data so far, because even with the symptoms like breathlessness, only if mother is actually not able to breastfeed the child, in such cases, like I said, we can find alternative modes of breastfeeding. But the symptoms like chest congestion, breathlessness, etc., will not affect your, I mean, the breastfeeding, the amount of milk she has to produce, I would say it won't affect at all. Most women, like 90 to 99% women, have shown really good recovery from all these severe symptoms as well. With the right treatment, yes, it won't affect, I would say.
Okay. And when will you say is the best time to take the COVID vaccine if you're planning a pregnancy? Like before, yeah, after delivery, when is the best time a mother who's planning a pregnancy can take the vaccine?
So if you're already pregnant, then you fall under really like sensitive or risky group of people, I would say. And also the government has not declared it that whether the vaccines should be given to pregnant and lactating women yet. But if you are still planning and not pregnant or not breastfeeding, you can absolutely go for it. Like I said, wait for at least 2 weeks after the second dose of vaccination before you plan the baby, so that you get this immunity, you are immune enough to the virus, and then you plan for it.
Okay. So basic 3 to 4 very key advices, very key points to keep in mind for a mother who is planning a pregnancy. Which are the three most important points you have to keep in mind if you are planning a pregnancy? Which would that be? As a prenatal coach, been so much into this topic, you would have known that.
Yeah. So, like I said, if you still have chance in your hand, if you still have time and you're still planning, please get vaccinated, because the vaccination has started for 18 plus above, and most states are already open for it. They are already started. So get vaccinated first, both the doses, not just one. And then after the second dose, give it at least 2 weeks or 3 weeks of time before you start planning for the baby. That is first most important thing to remember if you are planning for the women who are planning for the baby. Second, I would say, even if you get pregnant by chance in between, without getting vaccinated, do not worry. Take precautions. Take all the precautions at your personal level. Choose a hospital facility which is already equipped with all the COVID protocols, because that will ensure that you are in good hands, right? And third one is that avoid it's a basic rule anyway. Avoid going out or avoid contacts with multiple people, because obviously pregnant women are most prone to this. They're very at they're high risk. They're at high risk of this virus. So that's three things to keep in mind. And I would say with that, with those three things, you are absolutely safe. You can thrive through this.
Definitely. Actually,
Yeah.
now concern for the mothers who planning their pregnancy are that the government has increased the time for the second dose. Like only after 84 weeks you can take 84, I guess, 84 weeks or something like that. You can 84 days, I guess, you can take the vaccine. So
Mhm.
wouldn't that delay the progress of planning a pregnancy?
Can you repeat your question?
Yes, I was saying that since the government has now extended the day of till when you can take the second dose of vaccine,
Okay.
wouldn't
Uh-huh.
that
Yeah.
delay the pregnancy process for any women?
Uh, no, as such, like the time span is said to be 4 to 6 weeks now, so that the immune response develops in your body. And but if you're undergoing treatments for pregnancy, like IVF, etc., then definitely check with your doctors. Take permission from your doctor, and whether you can get the vaccination or not, because each pregnancy case is different. The treatments are different. So I don't want to comment on that, because we never know at what stage of treatment they are in. So it's always best to check with their doctor and then go ahead for the vaccination.
Okay, okay. And the last thing for the day is that what
Yeah.
vitamins and supplements that women should take during their pregnancy.
Um, so first 3 months of pregnancy and even before getting pregnant, as most women must be knowing this, you should start with a basic dose of like 400 mg, 400 to 500 mg of folic acid tablet, because that is important for the early development of your child. And post your first trimester, you will be usually given with a dose of iron, prenatal multivitamin rich in minerals like zinc, selenium, molybdenum. Those are important minerals for your baby's growth. And also calcium tablet as a surplus, because calcium need in pregnant women body, it increases by 500 mg than before. So these three are important: folic acid, then iron added with folic acid, because folic acid is basically required for iron absorption, and then a prenatal multivitamin containing basic minerals for a pregnant woman, and calcium, I would say. Apart from this, nowadays doctors are also giving vitamin C up to 1000 mg, then vitamin D up to 1000 IU international units. That's I think that's just because to develop good immunity during these COVID times. Even for the recovering patients, the COVID recovering patients, these two vitamins are recommended: vitamin C and vitamin D3. So no harm in taking these two vitamins as extra, along with your calcium, prenatal multivitamin, and iron.
Okay. Well, actually, as far as I know, since I've been dealing with e-commerce and government guidance,
Mm.
1000 IU vitamin C has been cancelled by the government. They have banned, I
Uh,
think, sell of
Vitamin D, right?
vitamin C. Vitamin C. They have.
It's not in IU. It's 1000 mg. Yeah.
G.
No, it's not cancelled it. I don't see because I have few of, clients who are pregnant. So 1000 mg of vitamin C is still continued for pregnant women, I think. So it will come as added. It will be added with vitamin D because vitamin D will, vitamin C will increase the absorption of vitamin D in your body, and of course then followed by calcium. So it's not discontinued yet. Only about the vitamin D doses, I think it will vary person to person. Some women are given one tablet a month. Some are given once in a week. So it depends on her blood profile as well, her blood test as well.
Okay. Okay, so that was it for today. I think we covered everything for COVID and pregnancy in this session. Anything else you want to add as a prenatal coach? Any insights that a women should know?
I wanted to add this point that most women are well taken care by their families at their physical needs, like what to eat, what not to eat, but also I think also their mental well-being is important because pregnancy during COVID times is not same as before. The women who are pregnant in COVID times are obviously way more stressed and anxious than the women who were pregnant and delivered in non-COVID times. So it's adding as extra stress. The COVID is absolutely adding an extra stress. So take care of your mental well-being also, and what you can do for it. Don't watch too many news, of course. Don't read forwarded messages because there is so much information around, and most of the time it's misguiding. It's not so true. So just trust on your doctor and the care you are provided with. Do not go with all the information around you, I would say, and also do not forget to or just be active. I would just be active or exercise at your level, like whatever you're comfortable with. Maybe it's just gentle walking, yoga, exercise like Pilates are also good. So exercise will help you overcome the stress and anxiety, I feel. And it's also important to stay fit during pregnancy so that you can have good fitness even post pregnancy, post delivery. So that's my only advice for the women who are pregnant during this COVID times. Do not panic. Do not panic, and trust your doctor's trust process.
Okay, so I think we are done for today. It was a very informative session.
Actually, there is a question. So maybe we can take that. There was a question in the comments.
Any question?
Uh,
What all medicines you can take during pregnancy? I think there's one question.
okay. Yeah, the other
What
speaker is
medicines you
Serenity.
can take during pregnancy? This was one of the questions.
Uh, can you repeat it for me? I think I missed it.
Yes, yes. There was a viewer who has mentioned what all medicines we can take during pregnancy.
So, like few medicines are definitely common, like I said, of basic folic acid dose of 400 mg, iron, calcium, and maybe a prenatal multivitamin is good to have. But it also depends on if you are deficient into certain things or you are undergoing any treatment, then the medicine course might vary. For example, most women are also given with extra dose of progesterone to sustain the pregnancy, or basic HCG injections as well in the early days of their pregnancy. So the course of medicines absolutely it varies pregnancy to pregnancy.
Okay. Okay, I think that is it. There was only 1 to 2 questions, and we have already answered all of them. The viewers are going to be happy to know everything about the pregnancy. So, people, if you have anyone, if you know anyone, your sister, your wife, anyone, your daughter, even, then please let them know. Please help them watch this video. It will be very much helpful coming from a prenatal coach yourself. So,
Thank you, Anshu.
okay.
I hope our conversation can help women who
Yeah.
are pregnant and not even pregnant or just planning to get pregnant. Yeah, all the best to all the ladies, and thanks Anshu for having me with you today. It was really a good chat.
Thanks a lot. Thanks a lot. Please save this video in your feed as well, so all your
Yeah.
viewers can also be able to
Yes,
check.
yes, sure. Yeah.
Okay. Okay. Thank you. Bye.
Yeah, bye.